the next structure is uterus. The very important structure for a female, because uterus or the womb is the place where the baby grows. So, this is from the outside. So, this view which we had seen is the inside and this is the outside of your structures. So, again here we can see the bladder, we can see the uterus, we can see the rectum and the vaginal canal. So, let us understand how is the uterus and what are its layers. So, uterus, the womb is the primary area for pregnancy, because in the uterus the baby grows, and the uterus has different layers, right. So, the outer layer we medically term it as the perimetrium, that is just the outer layer of the uterus. Then the middle layer, you can see thick pinkish colored structure throughout. This is the middle layer, that is the myometrium, and the inner layer of the uterus, that is the endometrium. So, the uterus has 3 layers: the outer layer, the middle layer and the inner layer, and all these layers has different function. But when we talk about the major function of uterus, that is to contract and relax. So, the uterine contractions which you feel during periods or a female feels during the pregnancy and childbirth are basically the contractions of your uterine muscles. So, yes, uterus is also a holomuscular organ. So, your uterus also has the muscle layer, that is the myometrium, and inside is this is the endometrium, or you can say the inner layer of the uterus. The myometrium or the muscular layer of the uterus contracts and relax, so that the uterus shortens and expands. So, it contracts during periods to expel out the shedded internal layer. It also contracts during sexual activity, so that the sperms can travel faster towards the ovum. Also, the uterus contracts during pregnancy for the preparatory phase, and during the childbirth, if it is through vaginal delivery, to expel or to push the baby out into the world. So, the uterus contracts during different parts or during different phases. The endometrium or the inner layer of the uterus is like a garden bed where the embryo gets implanted during conception or pregnancy, and then it grows there. So, the endometrium basically provides the nutrients to the growing baby. If a female is not pregnant, this endometrial will break, will shed, and will come out in the form of menstrual bleeding. In this uterine structure, if you see this part, the small part, this is the cervix of the uterus, or also the neck of the uterus, and this cervix works as a doorkeeper. So, it is basically closed and does not allow the external infections, organisms or structures to go inside the uterus. the cervix relaxes or opens a bit during ovulation, because ovulation is the most fertile time for a female. So, the cervix opens so that the sperms can easily enter the uterus and reach the fallopian tubes to mate with the egg. The cervix also opens a bit during the periods so that the blood and the other structures, tissues come out. Throughout the pregnancy, the cervix is closed and it develops a thick mucus plug. So, you can imagine the cork of a bottle. So, like that, the plug of the mucus is stuck here. It does not allow the external infections to go inside, and also it prevents the preterm labor or preterm delivery. At the time of childbirth, this mucus plug is released and that initiates the process of birthing. This cervix also play a very important role during sexual activity according to some school of thoughts. So, certain researches and school of thoughts believes that some females get a sexual pleasure if the cervix is stimulated during the activity. The cervix is further connected with the vaginal canal. So, this is the vaginal canal. During the time of childbirth, this cervix gets thinner and it gets relaxed. So, that is known as the effacement and dilatation of the cervix. It opens up and it becomes thin to ease the process or to initiate the process of vaginal childbirth. Cervical cancers are very common cause of death in the females, and the cervical cancers are preventable. To know more about the cervical cancers and HPV vaccines, you may contact your gynecologist and take the advice from them. So, you can see the uterus again in relation to other organs like the fallopian tubes or the tubes and the ovaries or the female gonads. So, uterus is connected with the cervix and the vagina down, and here it is connected with the fallopian tubes or your tubes, which are further connected with the ovaries. So, your fallopian tubes are not directly connected or attached to the ovaries, rather they have some finger like projection which we call medically fimbriae. They float around the ovaries, but your fallopian tubes are connected with the uterine cavity. This is an image of a diseased uterus and the diseases which can affect the other parts, that are the fallopian tubes and the ovaries. So, there are multiple diseases which can happen inside the uterus and even outside it, like endometriosis, adenomyosis, the blocked fallopian tubes or the polycystic ovaries. We are not going in detail of the pathological conditions in this video.